Good afternoon, everybody. It's Friday, the 29th of July, and the last Friday of July. Hope you've had a good week and hope that you will have a good weekend coming up. Today, Dr. Soutar is going to begin talking about functional neurofeedback. You've heard him and us mention the concept here over probably the past 6 months to a year. And as Richard said earlier, he and I are going to work on a paper on this. He's presenting some information at ISNR. So he's going to talk to you about functional neurofeedback. Richard, it's all yours.
Thanks, Rob. Yeah, we will be presenting this at a vendor meeting at ISNR later today. So you're seeing what we would be presenting there, even though you're not there, which I thought would be kind of nice for everybody. But we're introducing the concept of functional neurofeedback. And you've probably heard of functional medicine. I would hope at this point you've heard a little bit about it anyways. But it's a new and upcoming perspective on medicine. It's different from traditional acute care approach. And it's way more comprehensive and in depth in many ways. And so it's very exciting, but it does a kind of a biopsychosocial approach to the patient in medicine. And for us in neurofeedback, that's what we've built for the last 20 years. We've been building that approach and the tools for that approach, and we've been implementing it. And that's very much in contradiction to most of the other people in the field of neurofeedback. They aren't doing that. They aren't, they're more focused on the technology, under the idea that, if people aren't getting better really fast, we just have to make more powerful amps, more powerful software, fancier equipment, and that you need to get that expensive fancy equipment to make it work. But as Coben, Hammond, and Arns published, there is no solid evidence to back up those claims or even that idea. In fact, the research evidence runs against it, which is what we've always found, which is why we don't take that approach. And that's why I developed NewMind, because I used to work very closely with Brainmaster, but I broke away because I had a different vision than they had. I mean, they have a wonderful vision and they're a wonderful group. And I spent many wonderful years working closely with them. Love them all. But I had a different vision, and that was NewMind. So, with that, let's kind of dive in a little bit. Where did this concept of functional medicine originate? Well, it originated with somebody by the name of Jeffrey Bland. And he started doing lectures and had an institute, and a lot of medical doctors started attending those lectures. People like Mark Hyman and many others who are now pretty high profile people, and some of them are investigators. And if you ever look at a Mark Hyman podcast, what you're going to find is top academic researchers, the best out there, UCLA, Harvard, Yale, all the major medical schools. I mean, these top researchers is who he's talking to and discussing this concept of functional medicine. And it's very exciting because he implements it at his clinic, as many other medical doctors do, and they're getting really wonderful results with chronic disease, results that nobody in acute care is getting, because they're really not geared to do it. They're not trained to do it, and their whole paradigm is not prepared to do it, because it doesn't look at the whole person in such detail. It doesn't try to find the source of the symptoms. It tends to just treat the symptoms. So with acute care, you come in, you have a symptom, and there are protocols for those symptoms, and the insurance companies oversee those protocols and either validate or invalidate those protocols. And if you want to use something other than those protocols which the insurance companies have validated, you're really bucking the system. And if you're in a hospital, you probably can't do it at all. So it's very constrained in that sense. And the criteria for it is a lot of it comes from drug company research at Big Pharma and other similar groups. Whereas at a lot of the academic institutions, you're getting a lot more deeper research. And as you know, I hope you know at this point, that there's many publications, including out of JAMA itself, that shows that your average doctor is 18 to 20 years behind on the research. Well, people like Mark Hyman are right there on the edge of it. I mean, listening to him, he just rattles off research and people off the top of his head, dates, names, papers. My kind of guy. And he runs this clinic, and it's remarkable what they're doing there. And there are a lot of other clinics around the country doing the same thing. So this is kind of, what the atmosphere is of functional medicine and how it's developing. So the main core idea is functional medicine determines how and why illness occurs and restores health by addressing the root causes of disease for each individual. So functional medicine is after the source. What's the etiology? What's the source? Let's find the source and treat the source, and that requires a lot more detective work and a lot more testing, and it's much more global. And so functional medicine is less concerned with the dysfunction of a disease, and it's more concerned with the dynamic process that generates disease. So disease is a descriptor of a pathological endpoint. That's the endpoint of the development, the vectors that led to it. And function is about the sources of the pathological process. What led up to this? What are those multiple etiologies that led up to this disease? And how is it shaped by those multiple causal factors in a biological system? And they're looking at the body as a biological system, not modular organ systems. Oh, here's the heart, I'm a specialist there, and this is liver, I'm a specialist there, and this is GI, I'm a specialist there, gastroenterologist, enterologist. It's a scientific system based on the perspective of systems. It's a systems theory. And that carries over to what we're doing at NewMind too, because we're not looking at the brain in a modular way. The whole concept behind NewMind and the protocols is we're looking at a system, a complex, not linear, nonlinear dynamical system. And it's more like a weather system. And we're taking all of our concepts and research out of the neuroimaging community. And that's where we're getting it from. We're not pulling it from other places like EEG research only. That's not, because that's not enough. So there is the Functional Institute, the Institute for Functional Medicine, and you can get certified as a medical doctor there. And many doctors are starting to do that. And a fair amount of them are starting to show up at ISNR. This is a valid concept. There's a lot of policy people and who don't like it because policy people are in directorates that are interlocking. They call it interlocking directorates, where they are in policy positions in government and other places, and then they come out of companies, large corporations like pharmaceutical companies, and then they or companies like Johnson and Johnson, and then they go back into the companies after they've served, and so you get this interlocking directorate, this revolving door between the corporation and the this policy. So of course, this rocks the boat. These solutions and ideas are not in the policy. They're not in the insurance company's agenda, but it's taking hold because it's really working. And I can tell you personally, if I left my daughters to regular doctors, she would have died a long time ago. It's because of functional medicine doctors that she's healing and getting better. And she has dozens of friends in the same boat across the United States, and they all talk to each other all the time. And many of them locally have come to my office for neurofeedback and benefited from it tremendously. So the importance and validity of this rapidly developing approach has been recognized in JAMA, and there's your citation. In 2014, the Cleveland Clinic for Functional Medicine was established with Dr. Mark Hyman. He's the author of 12 New York Times bestsellers, and they're excellent books in conjunction with the Cleveland Clinic. And others have been leading the charge in medicine with the functional medicine paradigm, with growing evidence of significantly better outcomes than all previous approaches. You know, obviously, you got a broken bone or you need an antibiotic, you know, you can't beat acute care. They got that covered. But if you've got any unusual issue that's not within this narrow symptomatic paradigm, they can't do anything for you. And those are the people who come to your office as a neurofeedback practitioner. So the key features of the functional concept are also the key features of the functional neurofeedback concept. They cross over, and you'll recognize many of them from just our everyday lunch and learns and the stuff that I write anyways. And so functional neurofeedback addresses the root cause rather than just the symptoms. We're not just going to have a symptom and say, okay, they've got that symptom, so we're going to give this protocol. That's not how we work. If you look at our MAP system, it is not that way. It looks at the global neurometric picture. The brain is a system, and it recommends a protocol that will move the system as a whole, and the system self-corrects. And that's the concept in functional medicine too. We need to get at the root cause. We need to treat it systematically in a systems manner. It recognizes the complexity of contributing factors to disease, and that's why we have, you know, all these different assessment tools that you can use, and why we recommend working with other professionals in nutrition and other areas along with what you're doing. It promotes optimal wellness. So we want people to come in before they get ill and, you know, train themselves optimally, you know, so they can be better at their work, be better at home, be able to pursue their goals better in life. It's individualized. So we don't have a one size fit all. Everybody with attention deficit gets SMR up and theta down at CZ. Case closed. And neurofeedback was that way for quite a while. And Valdine Brown and I were the early adapters of the concept of systems. And Valdine was the first to really promote the idea of nonlinear dynamical systems. Of course, he ran into so much friction at ISNR, he had to leave. They did not like him because they wanted the more, and there's that division in our field. They want the more, you know, you got this symptom, you do this protocol. If you have this symptom, it's at this location, so just train at that location and you'll fix it, which technically doesn't make any sense if you really understand how the brain works. But I've lectured on that a lot before. So it's patient-centered, and the patient and the practitioner work together. We talk over all the aspects of your life, try to identify the root causes, and it's up to the patient to participate. I even have them sign a document saying, you know, this will not work if you don't participate, if you don't make an effort to sleep, to eat well, to sleep, to eat well, to exercise, and work with us. If you're not working with us and having us kind of coaching you through it, you're not going to get as much out of it. So that empowers the patient, you know, or the client, if you will. And it's science-based, but it's not RCT dominated. So everything we do is not based on random controlled designs and placebo and all that. Medicine is, to a fair degree, but the problem is, as been published by Ioannidis in JAMA long ago and is well known in the research community, 60% of the RCT research is defective. And it's not defective just because people do bad designs, which they do, and Ioannidis recognize that, but what he doesn't recognize and other people recognize in the behavioral sciences, because he's not a behavioral scientist, he's a statistician, is that the reason it fails so much is because people are too complex and too savvy a lot for it to work with. They figure out, you know, the double blind. They figure out who's getting treatment, who's not. And you have lots of placebo effect and all other kinds of confounds. So, you know, in our approach, we look at qualia, not just quantitative, but qualitative aspects. You know, we want to know how you feel, you know, what's going on, you know, what your mood is. We want to know what you like and don't like, and we talk about, you know, emotions and how they affect your health, and how they can interfere with your relationships, and how you can train your brain to perform better emotionally and enhance your whole life. So we really look at that aspect of things, because the neuroimaging research tells us, you know, Freeman, 2009, read it yourself, and everybody since then, that we're primarily structured to be emotionally relating group animals, in a sense. We're tribe people. Um, and it considers lifestyle a critical factor. You're not just coming in with a symptom. It's tied to your lifestyle, and we have to work on your lifestyle. And assessment requires a detailed understanding of each client's psychological, psychophysiological, and lifestyle factors. So it fits the psychophysiological model very well of biofeedback. We have a comprehensive statistical assessment and history. That's our testing. That's how we test. You know, we don't do blood tests. We do statistical testing on computerized performance tests, on symptomology, on socio-emotional behavior. So functional neurofeedback practitioners do exhaustive patient interviews covering all aspects of their lives, and then form hypotheses regarding the potential sources of the client's condition. It then utilizes scientific testing, both in initial assessment as well as in methodological and strategic manner, with each protocol intervention to assess its efficacy and help determine whether associated side effects justify such an intervention. So that's a lot in one paragraph. But it should be familiar to you now, because we provide testing, and we have brain mapping, and it produces you a protocol, and you utilize one of those protocols, and you check to see if they work empirically by their performance on the trend screen, and then you pursue that protocol, and the review screen is a constant test at the end of the session. It gives you an idea of their level of progress, and when gives you an idea when you can do the next map and assess the actual progress and what actually changed. So that is the test protocol process. You know, it's not, I just have the magic solution, I'm gonna do that one solution with everybody, no. And that's a key feature. So our assessment suite fills that mission. It's statistically based assessments constructed for the NeuMind database system. They were built in concert with the database from the ground up, and for the purpose of applying them from a psychophysiological perspective, rather than a medical or psychiatric perspective, to a biopsychosocial approach to neurofeedback. And you recognize these outputs, and that's why we encourage you to use all of the features of the system, because the more you do, the more you approximate the functional neurofeedback paradigm. And when you do that, we have data which is scrubbed according, you know, to the standards. And then we can process, and we do. And I give you information about that all the time, and I publish that stuff on nmindjournal.com so that you can go and look at it and see what we're finding from what we're doing here. Plus, you can go to the meetings like you're here today and hear what we're all finding from a case study perspective, and what we're hearing about in the research, and how we're applying it, and then how we're trying to get at the heart from a biopsychosocial perspective of the person's suffering, and come up with, you know, a complex array of well-suited solutions. And so here are our norms suite of instruments. Hopefully you all are familiar with them and use them. And so the new mind enables practitioners to assess multiple dimensions of psychophysiological dysregulation and their global contributions to presenting symptoms. We have the interactive self-inventory, which is a socio-emotional behavior assessment. It's statistically validated by a third party to reduce bias. It's cognitive emotional checklist, which looks at the cognitive emotional deficits. That's cross-validated with major standard clinical instruments. The physiological checklist, that's cross-validated with CDC population estimates of incidence of these symptomologies in the population. Computerized performance test, that's a cognitive performance tracking. That's cross-validated with the published norms of all these different tests, you know, the Stroop interference test, the Wisconsin card sort, the digit span tests. Those are all part of our test array. If you've heard of that, or if you go to somebody else and they have that. At ISNR, there's some people in the database system who are just starting to present that. We've been doing that for years and years and years. So they're following our lead, and we're really happy they are, because the more that people do, we believe, the better they'll do neurofeedback, and the better everybody and all the vendors will benefit. And we have symptom tracking to track changes. Did this work, what we did, and assess, should I keep doing it or not doing it? And the pre-post compare tool, which does the same thing. And it's the only one I know of out there that evaluates the percentage of normative and reorganizational change. I don't know anybody else is doing that, or even has the theoretical perspective or the data to do that. But I imagine down the road they will. And in a way that you guys can use easy and is accessible, and is not, you don't need a PhD in statistics to do it and understand what's going on. Okay, so all of that I think makes this a superior method for doing neurofeedback. You know, by using multiple measures in conjunction with QEEG-driven standard neurofeedback, a one-size-fits-all approach to client wellness is avoided, and a more effective and individualized, empowering, and empirical approach is encouraged. So that's the whole concept in a nutshell of functional neurofeedback. So with that, I'd like to just open it up to any questions or comments that we might have, and Aaron should be unmuting everybody with his one-shot unmute all magic button. And you didn't have to go to ISNR to hear about it.
Well, yeah, I'm very curious to hear others' thoughts about this.
Yeah, anybody have any comments or thoughts, or anybody skeptical, or think it's a good idea, a bad idea?
I have a comment. This is Carl Johnson.
Hey, Carl, love to hear it.
Hey, well, I've been using the software for quite a while, and I find that it's really accurate. Like when I'm with someone, and I still use the functional deviation information that comes from the brain map report, and I go that with the patients, and like at least 98% of what's listed there, the client goes, yeah, that's me. So, you know, when you look at that plus all the other features, and I use all of this, all of them, the cognitive performance testing, the ISI, CEC, you know, the brain mapping, all that, and I find it great, and I love the functional approach that you purport through the organization and the whole systems that you use, because it really matches.
What happened? Shit.
Oh, did we lose?
Carl, we lost you for a second.
Yeah, okay.
He's talking, but we're not hearing him. I'm not sure what's going on. But you're all hearing me, right?
Yes, we are.
Okay. Well, we lost him, but just he can hear us probably still. I'm going to say the reason it's accurate is because it's all statistically based on probability. And those statistics, how we conceptualized applying them was based upon the neuroimaging research primarily, not the EEG research. I mean, there's a fair amount of that in there, but we relied heavily on because they have way more money, and they're a massive group, and the information coming out of them is incredible. By harnessing that and applying it to what we're doing statistically, that gives us a great power, and I think that's what makes it accurate. And I know Carl's functional in his perspective. Functional chiropractic is been growing for decades, and I even had an office with a functional chiropractor. And I did that because I wanted to be working with him. It was amazing to watch what he was able to do with people from a physiological perspective. And he loved neurofeedback and biofeedback. So it was a great combo to have both in the same office. It really is.
I heard you say everything except artificial intelligence.
No, I don't have artificial intelligence in here. That's above my pay grade. If Google buys me out, maybe we'll have it at some point, but we don't have it now. True, we're not there yet. But it would help. It would help me process all the data I have. But Gary, that's a lot of money and a lot of time, and we're just a small company. We're not like UCLA or Alphabet.
I see Mark Hyman writes a lot of food and diet books. Do you have one you can recommend?
Geez, I can post it. He's written a couple, and I don't have it off the top of my head, but he's written a couple of really good ones. And one of my favorite ones, he actually goes through the politics of how the food industry works and who's involved and who in the government's involved. And when you read that and the bills and all the politics behind the food, you realize what a hugely political process it is. And one of the reasons is it's like oil. It's a massive industry, and they make massive amounts of money, and they have a huge number of lobbyists that they fund in Washington, and that controls a lot of the legislation.
Is that the food? What the heck should I eat?
Yes, that's it. I think that's it. I'd have to go back and double check, but they're all really good. But that might be the one. At any rate, his podcasts are just terrific. I would just, anybody who's in neurofeedback, I think would enjoy them, because they have a lot of people in there who deal with issues that we deal with, and you see how functional medicine people deal with it and the science behind it, and who at the universities is doing that science, where they've published and everything else. It's a wonderful podcast resource.
Yeah, Hyman's podcast is really good. I've listened to a lot of his programs.
Yeah, that's coming from Yannick, who's a real biohacker at the highest level.
Yeah.
That's a compliment. Definitely.
Yeah, that's when I started off, when I was really getting into the functional aspect and learning it for myself first, right?
Yeah.
And Hyman was one of those important voices, really getting it out there, because I think that's been probably his most important contribution. Just like, getting the people to talk and opening space for conversation and new approaches and everything. So that's something I really respect from Hyman.
Yeah, he operates from a research perspective like we do. And that's his primary source. It's not just hearsay from the other docs or a CE, a visit to get his CEs every 2 years or whatever. And it's, not just talking around the water cooler, and that happens a lot. I mean, that's what hurts neurofeedback so much. You get a bunch of psychiatrists together. Well, I heard it's not that great. Yeah, it's, it's a lot of woo-woo, nobody's citing research or anything like that. Just somebody who has, whose opinion is held high, just randomly starts saying stuff, what they think, ill-informed, and then suddenly neurofeedback in the psychiatric community is of little value. And that kind of stuff goes on all the time in medicine. People don't read the research enough. That's why they're 18 to 20 years behind. Yannick eats research for breakfast, lunch, and dinner, and I think he stays up late at night with it too.
Oh, yeah.
And not a medical doctor.
Yeah, it's more of a approach of I think seeing what is being said and not who is saying it, because
Yeah.
that's where all these assumptions and like fairy tales are born. And you just repeat it enough and then you believe it's, the real thing. Just like in the Second World War.
Yes.
The master marketing. I think I don't remember the name of one of the generals, but he just used to say that repeat a lie 1,000 times and it'll become a truth.
Yeah, well, that's true in politics too.
Yeah.
And that's obvious today. So, but that's what it goes all the way back to Rome and before that. That's what they did. We all learned that trick 10,000 years ago. Started in Sumeria. It's pretty well
Yeah.
documented. But there are people like you, Yannick, who, didn't go to medical schools or have medical degrees, but are really well read in the research and have a profound knowledge and are able to help people a lot. And there's one famous guy, I'm trying to remember the name of his company. He's famous. They sell his stuff at Walmarts and everywhere else now.
Probably Dave Asprey.
Yes, Dave Asprey. He was an investor or something, and then he almost died. And he massively overweight, horrible health. And then he started just reading and trying everything, totally focused, built a whole company around it, and has been helping all kinds of people tremendously. And his products are sold all over the world, and they're really good research behind them.
Yeah, Dave Asprey's really daring, and that's what I
Yes.
like about him. He dares to go out there and say things, and even if it's controversial, it just doesn't pick fights, and that's I think the best way to do it.
Yeah, he's just
but
doing it. And Mark Hyman and him have a couple of podcasts together, which are fascinating to listen to. Because you meet the doctor scientist talking to the biohacker. It's, but you really do have to check the citations and the research, because there's biohackers out there who don't know what they're talking about, just making stuff up. Just like
oh
in
yeah,
neurofeedback, we have that issue too.
yeah, definitely. Dave's really gotten in there. There's just one big, well, actually two big things that I go like, okay, no, we really do need to sleep a lot, and he doesn't want to sleep because he's a peak performer, of course.
Oh yeah.
Like,
Well,
oh no, let's not waste time in sleep.
that's why you need to be careful, because all the research we have argues against that, and it's good research out of the best institutions in the country.
Yeah, yeah, definitely. So it's pretty much like saying, okay, what is he saying? Does this make sense overall? He's great for several topics, but some major ones like sleep, you're like, oh, don't sleep, get stem cells, and you can sleep 5 hours instead of 8. I'm like, oh boy.
Yeah, that's not the everyday person, and that's why you need to be tempered. And that's why somebody like Hyman and others like him, they're much more conservative and realistic, because they actually treat patients, and they're medical doctors, and that they're medical doctors who read research. This Seberger clinic
Mm-hmm.
in Kansas is the same way. And they operate the same way as like the Hyman Clinic, and Veronica's on here a lot.
Yep,
Listening.
I'm
But
on.
this is their model too, right?
Absolutely. Just hearing you speak earlier, as to, when we're thinking about the brain, we have to think about other things too, and what we're measuring, and that's the functional part. And again, I don't know how many times I've said this, but I will continue to repeat it. But the physiology aspect, or the patients or the clients get to self-report, you can kind of gauge as to where they're at, whether they're under-reporting or where they're at, and all their symptomologies. That is really the headways to what leads us um, um, to really identify what's going on physiologically. This person is, identifying these pains or aches or sleep or fatigue or whatever it may be, to to kind of move in directions to what labs to collect. And I mean, I'm here at ISNR, and I've sat with a few people. There's a lot of new people. Yeah, I'm here. I plan to be in your small group later this evening. It looks like you're on the schedule.
Is James there with you?
Yeah, but he's at SeaWorld with the kids.
Well, that's different. He's the research hound. And
Yeah, he is. Well, he's already given me lots of things to look at and to ask and to communicate.
Yeah.
So he's giving me some homework to do while I'm here. But we can't thank New Mind enough, and a lot of the newbies that are kind of sitting at my table where I was at earlier, and like, go learn about New Mind, go ask questions. I'm like, this is, it's incredible, it's remarkable. This is something you should probably really look into. So send a lot of people to your table.
Well, we appreciate that, because you're promoting the functional approach, and the more
Yes,
that
absolutely.
happens, the more it will grab the neurofeedback field as a whole, and I think the more effective we'll be as a whole if we do. Then we'll interface better with other practitioners.
Right, right. So thank you very much.
Yeah, well, we thank you guys, because you integrated it into that fabulous medical clinic you're running, which is way ahead of its time. And I've watched the case histories that James has presented, and it's just stunning to watch how he goes through a map and testing and analyzes a client. It's like watching Hyman with neurofeedback. It's just jaw-dropping, the changes he gets. You just think, God, if only the other physicians would just start doing this, we could just have so much more powerful remediation of all these symptoms. But it'll be a while. It'll take some time. So we appreciate that. Veronica, thank you.
Soutar, we had a question come in. Somebody's asking if you have a theoretical outline of functional neurofeedback, kind of just a foundation that they can build off of.
That's it. That book, Holistic Neurointegration, pretty much fulfills that. And the book Holistic Neurointegration is, if you're a New Mind user, that's available to you for free. If you're not a New Mind user, a lot of times you have to pay for it, although sometimes at the meetings we give them away kind of as door prizes. But that book is available, and it covers everything, including a lot of the research we've done out of New Mind, and covers alpha, theta, 2-channel training, the physiology, all of it. It's an ebook, and I'll be updating it every few years. I'm working on a book on which takes a functional approach to PTSD and trauma with the utilization of neurofeedback. And that probably won't be out till next year, but it's in the process. So we're moving pretty strongly forward with this. And we also have the ability now to use dry sensor devices to brain map people at home and train them at home. And those are in beta mode now, and they're up and coming, and you'll be seeing that pretty soon. We should open things up quite a bit. I know at the meeting I've heard that there's a lot of interest in home training, and we've long ago felt that would be the direction the field would be taking a lot, and it is. It's been very interesting to watch. So that'll help us propagate the concept of functional neurofeedback more widely. And this is over and against that concept that, you know, you can just change, do neurofeedback and that'll fix everything. I mean, I love that idea, but it never worked. And there's good reasons it doesn't. And it's not because you don't have the right protocol or equipment, but because you have to look at the whole picture. You have to look at the person is in a group of nested systems like Russian dolls, you know, and they're on the outside is the environmental, ecological input, and then you've got the social Russian doll, and then you've got, you know, what's all in that social. You've got the family within that Russian doll, and then you've got the biology of the person, and then you've got their neurology within that. And all of those resonate together, and you have to account for how all those systems are interacting to produce the dissonance that generates the symptoms and the suffering that people have. And that's the meta vision of this perspective of functional neurofeedback, is that, and that's why all the assessments address that comprehensively. The reason I favor that perspective is because when I was in graduate school and we were studying addictions, that was what we were working on at our university and some of the other universities. And that came out of not just psychology, but sociology too. It was a social psychology perspective. Talcott Parsons in the 40s predicted everything that we're doing in our whole perspective out of Harvard. Most people don't know he ever existed or who he was. He's a sociologist out of Harvard. He wrote about all of this stuff and systems perspective and how we'd be here at this point in history. I was heavily influenced by his writings, and symbolic interactionism as well, and had a profound impact on how I look at the psyche and how it interfaces socially. And Carl Jung, the psychological side, had a strong impact. You know, and I was very interested in statistical instrument production, but I was very, you know, put off by the methodologies they use. So I wanted to use different methodologies. And so all those come together for me as a natural. When I went in the field of neurofeedback, I said, this field really needs all this stuff. At the same time, there were people in medicine starting to do the same thing. But I remember Bradshaw and family systems. That was a huge influence on a lot of us back in the 80s and into the 90s. But these things come and go. People tend to forget them, and we get people in neurofeedback. Most of them coming in weren't in addictions and family systems. A lot of them tended to be PhD psychologists. So that was not the perspective, and I felt like it was too biased in one direction. I mean, I had my share of, I taught behavioral modification in graduate school in Phoenix. I'm deeply familiar with all of those behavioral perspectives and the reductionist approach. And I saw it as failing a lot in a lot of places, and there was a lot of good critiques of it. So we really needed to open things up, but there was and still is a strong flavor of that. And that's okay, because we need these different perspectives to kind of resonate back and forth and have minor dissonance in order to enrich everybody's thoughtfulness and enrich their efforts to dive deep in the research and really explain themselves and really apply it.
Yeah, and I think you know, seeing it as a nested system, everything we interact with, how we interact with, understanding we're part of something bigger, you know, the environment. And I mean, there are things that we can't control, but there are other things that we can, and most of them by knowing how to fit in it. It just which is self-modulation, part of what neurofeedback does as well, right? So I've recently even designed a part of, you know, not just the personality patterns, but also the social interaction for the social environment. time structuring what are the activities they carry out in a day. And I do this for a prognostic value, because I know which types of personality traits are the ones that are going to be more prone to success, which ones aren't, or how to interact with a spouse or children so they have higher probabilities of success. So that it's more recent, but I just couldn't avoid seeing it all the time, so I just had to integrate it.
Well, that's we need fresh vision, from outside the field, proper, I mean, to give us new insights, because you can get stuck in old rigid thinking about family systems or personality theory or any of it. And there's seven major paradigms in the field of psychology, and that's a good thing because they all challenge each other, and people come from outside, from other disciplines in, and challenge cherished traditions and ideas, and that helps move everybody forward. So that's great that you're exploring and expanding your concepts, Yannick. I think that's terrific. We'll be expecting to see your book one of these days soon.
Oh, yeah. I hope it won't be too long from now.
That's great.
Yeah, and it was, it's so funny. Sometimes you bump into research you're not expecting, and like, whoa, this is really interesting.
Yeah, it can really challenge you and force you to change the way you think about things.
Oh, yeah. Yeah, one of the most important ones I bumped into was this personality approach, which it wasn't really transactional analysis, but one of the pioneers in another field, which used all that, and the director in NASA that had been there for 20 years, asked him to go and just use it on people and see how they would do. And he noticed that he was doing it in 5-10 minutes, and director, which is really smart guy and everything, but it was taking him in 2-3 hours. So he said, like, well, what are you doing? And they started researching it, and they could predict the interaction between different astronauts and the captain and the others, and how they would interact, and it was just so amazing. So I started reading that, and I read through, it's like systematic, and I read it experience of myself during the lockdown. And I was like, whoa, yes, this happened to me. Oh boy, this did too. This in this order. And I was like, whoa, what's this? So it really trapped me. And so you just bump into things sometimes, and it's like one of the best things you can. You don't expect it, and it's amazing.
Yeah, and that's great. And sometimes it comes from unexpected places. Well, we're getting close to the top of the hour. Anybody have any final comments or questions about what was presented?
I'm trying to wait and let people ask any questions, but I do have to put a comment in and say that, what you presented and the way that we work here is such a fit to how I think that it just feels very natural to look at all these different parameters in order to make the appropriate decisions in how to best help people. And so I think it's great that you're working to spread it to others. And I continue to be surprised that most people don't think this way, because it just is a superior method, as you say here on the screen.
Yeah, I agree, Judy. I went to my second functional medicine physician yesterday. He's now going to be my primary physician. And the difference in everything you do, like as Richard said, typical doctor visit, they spend about 7 minutes with you. What are your symptoms? Here's a script for your pill, or here's your procedure to go to, or here's your surgeon. And then you're in and out in 10 minutes. I spent 2 hours in this guy's office. Part of it was for a physical exam, but most of it was going over my history, going over labs, saying, everything looks good. This is let's go check this out. Are you exercising? The whole 2 hours with the doctor.
Yeah,
That's a huge difference than what I'm used to doing. So
it is.
I'm looking forward to working with you on this project.
That's great. You found somebody. Yeah, you got to kind of really dig to find them, but they're out there.
Yeah,
Great to work
absolutely.
with.
Yep. All right, folks, it's Friday. You all have a great weekend. Be
Yeah.
safe out there. For those of you in the South, we have temperatures hitting triple digits. Be careful, keep hydrated.
Yeah.
Watch yourself, watch your family, watch your pets, carry bottles of water, and be safe. We'll see you on Monday night.
Yep.
See you Monday night. Thanks again for the presentation.
Yep.
Yep.
Bye, everybody.
Great weekend.